Welcome. My name is Betsy Mercier, and I am a Technical Assistance Specialist and Evaluator for the DaSy Center at SRI International. In this module, we will discuss two types of data that you can use to inform all aspects of your work: quantitative data and qualitative data. In this session, you will learn and reflect on why it's good practice to collect and use data. You will understand the differences between quantitative and qualitative data and why both types are important for answering critical questions. Finally, you'll have an opportunity to practice analyzing both types of data. Let's talk about how data can support early intervention and early childhood special education programs. Data are useful in all aspects of early intervention and early childhood special education programming. First, data can help you assess the quality of the services your program provides to children and families. Knowing which parts of your service delivery are working well and which may need some tweaking can help you improve your services. You can also use data to examine gaps and understand who has and does not have access to services and supports. Third, if you have data, you can use it to advocate for policy change and investments at the federal, state, and local levels. Presenting data is also a great way to increase public awareness and understanding of your programming. You can also use data to build trust in and across systems and communities, because data can provide a shared understanding of your program and its activities. Finally, using data thoughtfully can help state programs achieve positive and equitable outcomes for the children and families they serve. Now let's talk about the two types of data. Two types of data can help you answer many questions you may have about how your program is operating and about the children and families you serve. As we'll see shortly, the type of data you use will depend on the type of questions you'd like to answer. First, quantitative data is data in the form of counts or numbers. This type of data is any information that researchers can use for mathematical calculations or statistical analysis to make real-life decisions. Quantitative data are about numbers and can answer questions focused on how much or how many. The second type of data is qualitative data. Qualitative data describe qualities or characteristics of something without the use of numbers. This type of data can answer questions about the how and why of a phenomenon. Let's dig a little deeper into what we mean by quantitative data and when you might use it. As we've said, quantitative data are numerical. They represent things that you can measure objectively, such as numbers of children served, how often services are delivered, and how many trainings took place. You can use quantitative data to understand if you have a problem or issue that needs attention, and to answer questions like how many, how much, and how often. Why would we use quantitative data? Well, most importantly, this type of data provides concrete and specific information from which you can gain understanding and make informed decisions. Quantitative data are also efficient because they're recorded in an easy-to-understand metric. You can collect a lot of quantitative data efficiently, for example, through a state survey. Numeric data can often be analyzed quickly as well, using technology such as a statistical program or Microsoft Excel. Using quantitative data allows you to summarize a lot of information concisely. For example, you can summarize changes in child outcomes ratings for children across a state or region using simple averages, or you can compute percentages of children served across different years. Finally, quantitative data are often required for accountability or reporting progress to funders. The Part C and Part B 619 indicator data are examples of quantitative data that are needed for reporting. Now let's discuss where you can get quantitative data. This slide shows 5 sources. Closed-ended survey items are items that have a limited set of possible choices that can be converted into numeric values. Multiple choice questions, yes/no questions, and questions that require a numeric answer, such as a child's age, are all types of closed-ended items. Demographic information, such as gender, race, ethnicity, and language spoken in the home, are also typically quantifiable, as are counts, various types of administrative information, and financial information. Now let's turn to the other type of data, qualitative data. Qualitative data are, by definition, not numerical. Qualitative data provide information that cannot be fully expressed or understood using numbers. This type of data can be time-consuming to collect and analyze. For example, it might require scheduling and conducting several in-depth interviews and then analyzing the responses with a team of stakeholders. The benefit of those efforts is that qualitative data often offer rich information that can answer critical questions, such as what makes an intervention effective, or why an intervention is more effective in one region than in another. So why should you use qualitative data? This type of data is very helpful whenever you want to explore, understand, or explain something that's happening that cannot be fully understood with numbers. Qualitative data often bring numbers to life and help you to tell a compelling story. Using qualitative data, you can highlight the people who are behind the numbers, describe a quantitative finding with an example from the field, and share illustrative quotes from the people you're serving. Using qualitative data is also considered a best practice for collecting, analyzing, and using data with an equity lens. This is because you can use qualitative data to elevate the voices of people from small groups who may not be well represented in conventional quantitative data. Where can you get qualitative data? Open-ended survey items are items that do not have a fixed number of responses. Often, open-ended items ask questions like, do you have any suggestions for improvement? Or is there anything else you'd like to tell us about your experience in the program? Interviews and focus groups are other ways to gather qualitative data through open-ended questions. Many state staff also conduct qualitative analyses through their review of various policy documents and other written materials. Document reviews allow you to summarize qualitative information. Simply put, quantitative data answer the question, do we have a problem? Whereas qualitative data answer the question, why do we have a problem? Because they answer important but different questions, quantitative and qualitative data can be very powerful when used together. Let's take a look at an example so that you can see both of these types of data analysis. This is a high-level example just to give you an idea. There will be additional EC data use sessions that will dive deeper into both of the data types, but we want to show you an example of how these two types of data might look in your work. Let's imagine that you are curious about the effects of COVID-19 on your early intervention program. You have a hunch that the numbers of children your program served may have dropped during COVID, but you don't know the extent of the problem or why the numbers may have dropped. So your questions are, did the numbers of children served in your program drop during COVID-19, and why or why not? Notice that you're asking two different types of questions. The first question is about numbers of children, so you're going to want some quantitative data to answer that question. But the second part of the question is a why question, and qualitative data might be the best way to answer that one. Let's look at some quantitative and some qualitative data that might help answer these questions. Here are some quantitative data on the numbers of children served in the early intervention in the years 2017 through 2020. Let's take a moment to notice all of the information available in this chart. There are 4 sets of colored bars that show counts, or the number of children served in early intervention in 2017, 2018, 2019, and 2020. Each year is represented by a different color, with counts from 2017 shown in yellow, counts from 2018 shown in blue, and so on. The number on top of each bar is a count of children served in that year. The 3 sets of colored bars to the left of the broken line represent the number of children served broken down or disaggregated by age, birth to 1 year on the far left, then 1 year to 2 years, and 2 years to 3 years. For this exercise, let's focus on the bars to the right of the broken line, circled in red. These bars show the total number of all children served, birth to 3, in early intervention in 2017 through 2020. Looking at the numbers, or just at the height of the bars, we can see that the numbers of children served increased each year from 2017 to 2019, with the highest count in 2019 at 19,186 children. In 2020, when the COVID-19 pandemic began, the number of children served dropped to 15,712. We can see that fewer children were served in 2020 than in 2019 and 2018. So these quantitative data offer an answer to the question of whether the number of children served dropped during COVID. Now let's see what we can learn about the question of why that number may have dropped. Here is some qualitative data. You'll notice right away that these data look very different from the bar chart we just looked at. These data are from interviews conducted in 2020 with parents of young children who were referred to Part C. During the interview, parents were asked to describe the process of getting their child evaluated for early intervention. We'll look at the responses that 2 parents gave to this question. As I read the responses, see if you notice any patterns or themes in the data. Parent 1 responded, "I had concerns about our daughter and wanted to ask the pediatrician, but I was busy working remotely and trying to deal with the kids. When we finally got around to calling the doctor, they weren't taking appointments for well care visits. I finally got in last week and the doctor told me about early intervention." And parent 2 said, "I finally found out about EI from our doctor, but by then our well child visit had been delayed for about 4 months. Then we got a referral to EI services, but they were booked out for months. It took a long time to get scheduled." From these 2 examples of qualitative parent responses, we can see at least one theme that may help us answer our why question. Both parents were referred to Part C services by a pediatrician, and both had long delays in getting to talk to their doctor. One parent described a similar delay in getting an appointment with the early intervention program. From this information, we might hypothesize that fewer children were served in 2020 because pediatricians, a main referral source for Part C services, were busy with COVID cases and less able to meet with families who had less acute concerns about their children. In this example, we used quantitative data to determine if our hypothesis about serving fewer children in Part C during COVID was true. Then we used qualitative data to provide some context about why the drop in services might have occurred. We learned that the number of children served did drop below numbers served in the previous 2 years. And we heard from some parents that long waits to talk to their pediatrician meant that they did not start the Part C assessment process as soon as they might have. This slide lists some questions you might answer using the data we just looked at, such as how many children were served in 2019 and 2020, and did the numbers of children served drop during COVID? We also learned from parents about some issues with getting children evaluated for Part C services. Often, data analysis leads to new questions that you might try to answer and give you ideas about your next steps. You might, for example, want to think more about how the data were collected and whether your data include everyone you need to hear from. You might start to think also about whether the children and families who did receive services had particular characteristics. This is just a brief example demonstrating how you might use quantitative and qualitative data together to answer some critical questions. In practice, you would likely look at more data, such as the number of children served in different regions or districts. You would also want more qualitative data, for example, responses from more than just 2 parents, to identify some key themes. This slide lists some resources you can use to learn more about quantitative and qualitative data. This concludes our course on quantitative and qualitative data. DaSy Center technical assistance providers are available to support you with any of your data needs. Contact information for TA liaisons is on the DaSy website. Please visit us at dasycenter.org and follow us on Twitter at DaSy Center. And thanks for learning with us.